Good morning, and thank you for listening to me today. My name is Sanjeev, and I'm a medical student from England, so not quite a doctor yet. And I did a literature review looking at antibiotic sparing approaches for managing patients with recurrent urinary tract infection. This is a very exciting area, an area of great development over the past few years, particularly with the rise in antibiotic-resistant bacteria. So my aim was to assess two methods of UTI prophylaxis, namely vaccinations and intravesical therapies. I did this by searching a number of databases, as you can see, over an 18-year period. And I was looking for studies of adult subjects, but excluded those studies focusing on UTI in pregnancy and in patients with urinary tract and renal disease. After collecting the studies together, I then used the OCEBM levels of evidence tool to then assess the quality of the literature supporting each treatment. So what did I find? Overall, I found there's very strong evidence to support the use of three treatments. Firstly, OM89 or Eurovaxom, which is a type of vaccine administered orally, and this results in a roughly 40% risk reduction compared to placebo. Secondly, there's Eurovac, a vaginal suppository and another type of vaccine, which results in around a 20% risk reduction versus placebo. Then there's intravesical hyaluronic acid plus or minus chondroitin sulfate, which results in a 16% risk reduction. There is also evidence in the literature for Euroimmun and intravesical heparin, but as you can see by the levels, the quality of the literature is much poorer. And although the top three treatments are supported by meta-analyses of randomized controlled trials, there are some limitations I'd like to draw your attention to. Most of the trials in the meta-analyses are small in nature with low participant numbers. They also had a short follow-up duration of generally under a year. There have also been few studies comparing the vaccines and intravesical therapies to antibiotic prophylaxis. Most of the studies are placebo-controlled, particularly in terms of side effect and cost. In conclusion, the review has shown that non-antibiotic prophylaxis can be very effective and can be a useful tool in order to reduce antibiotic resistance, which is a looming crisis. However, more research is needed, particularly looking at longer-term follow-up, cost, and side effects, particularly comparing directly to antibiotics. Thank you very much. I'll be happy to take any questions.
May I start by complimenting you on doing this during your student days? We want young people to start science early because it takes a long time to learn things in life, and it's good if you start early. Very good.
Thank you.
Can I start with one question? Because I looked at the list of factors you looked at vaccination, but one topic you didn't mention was local hormone therapy, which has been indicated in recurrent urinary tract infections. Did you discard that, or did you avoid that, or didn't it come up on the radar?
Sure. So the reason I chose these two therapies in particular is because they're much newer. I believe hormone therapies and other types of therapies have been around for a lot longer. The literature base is much larger. These are much newer treatments, and there haven't been many reviews so far on these.
There is a Cochrane, though, on local estrogen therapy for recurrent urinary tract infections.
Right.
Yeah, Kate.
Kate.
Why did you exclude overactive bladder syndrome? Are you hypothesizing that urinary incontinence promotes UTI? Because if so, I'd like to hear about your thoughts on the subject, even though you are only a medical student, which I can appreciate.
So I just felt I should exclude all sorts of conditions affecting renal and urinary tract disease, just to so patient just keep it plain and
general,
simple
across the board.
Yeah.
Oh, okay. All right.
Maybe Maybe I could add a comment to that. I am the last name on this presentation,
Right.
Vipash Mishra.
He's doing very well without help. He's doing extremely well.
Thank you. Well done, Sanjeev. I do believe urinary incontinence is a factor in UTI because moisture and bacteria go together. So I think if we, in recurrent urinary infections, one of the reversible factors we could reverse is urinary incontinence. I do, although, I mean, this is just my intuitive sense.
Right. Well,
Thank you.
Lawrence?
interesting.
Lawrence?
Lawrence Stewart, Edinburgh, UK. I think it's fascinating, but you're only going to find meta-analyses for big companies who spend lots of money doing lots of research. In practice, we use all sorts of things. So did you find any evidence for D-manos or probiotics or...
Or methanamine hippurate?
Methanamine, yeah.
Yeah, so I think, yeah, you're right. Cochrane Review has been published on these sorts of treatment recently. So methamine hippurate has been shown to be effective. Vaginal estrogen, I think, is effective also. But my review wasn't looking at those things as such.
Yeah, it's a pity because I think we should look at these things because they're cheaper, probably.
Thank you very much indeed.
Thank you.
Yeah.